Coronavirus numbers for the week are out. It is Wednesday. They are down slightly from last week. State reporting 25,968 new cases over the past 7 days, averaging out to 3,700 new cases per day. 139 more deaths also being reported over that same 1 week period. As we head into the holiday weekend, local doctors are warning people to keep the risk of COVID in mind.
The warning comes as we're learning more about the impact of long COVID and how many people may actually be suffering with it. Dr. Frank McGeorge is here with the latest. But first, Doc, what's your take on the latest weekly coronavirus numbers that we just mentioned?
Well, you know, Kim and Devin, we're hopefully reaching a plateau in new cases. But big picture, though, while hospitalizations are also slightly up, it's much less than before. And more importantly, ICU admissions are not rising proportionately, meaning thanks to many different factors, people just aren't getting as sick. Now, meanwhile, 2 new studies are highlighting the risks of long COVID. And tonight, Henry Ford's head of infection control and prevention says with community spread still high, that risk is one more factor that people need to consider as they make their holiday plans.
I think people look at COVID and say, most of us are going to be fine. We're not going to wind up in the hospital.
But Dr. Dennis Cunningham cautions there can be long-term implications.
That long-haul COVID is very real, where people can be impacted for quite a while. So that should really go into people's equations, not just the short illness you're going to get through. You don't want that fatigue, the brain fog, the other symptoms. So prevention's the best way to do it.
A new report from the CDC finds approximately 1 in 5 adults now have a health condition that might be related to their previous COVID infection. That includes neurologic and mental health conditions, kidney failure, cardiovascular and respiratory conditions, and blood clots. And those issues can linger. A new study by Northwestern University followed patients with long-haul symptoms. They found most continued to experience symptoms 15 months after their initial infection, including brain fog, numbness or tingling, headache, dizziness, blurred vision, tinnitus, and fatigue. Most had increases in heart rate, blood pressure, and gastrointestinal symptoms, though many had regained their smell and taste.
There's people who are have trouble getting out of bed, going to work, doing their activities of daily living, taking care of their kids, all the things we all have to do.
Dr. Cunningham urges everyone to enjoy the holiday weekend, but safely.
I hope people are being careful because I know everyone, including me, is tired of COVID at this point.
Now, Dr. Cunningham says if you are going to be indoors with others, he recommends wearing a mask. Now, if you're outside, it's much safer, unless, of course, you're packed in very close together with a lot of people.
Yeah.
Back to you.
Okay, Dr. McGeorge, thanks.